Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. RSV versus Cold Symptoms and Severity in Adults and Kids. Respiratory syncytial virus, RSV, causes cold-like symptoms in most people but can cause more serious problems in some, especially babies and older adults. Almost all children get RSV at least once by the time they turn 2 years old. /r/n/r/n The common cold is an upper respiratory tract infection caused by different viruses, most commonly rhinovirus. Adults get a cold an average of 2 to 3 times a year, and children tend to have more than that. A cold shares many symptoms with RSV but is less likely to cause severe illness. /r/n/r/n Both colds and RSV have symptoms such as sneezing, runny nose, cough, sore throat, and decrease in appetite. Babies with RSV may be irritable, fatigued, and have breathing difficulties. /r/n/r/n A barking or wheezing cough could be a sign that the RSV virus has spread to the lower respiratory tract, possibly leading to pneumonia or bronchiolitis. While RSV is mild for most people, it can lead to hospitalization for some. Up to 10,000 older adults in the United States die from RSV complications each year. /r/n/r/n West End 61, Getty Imagesrnrn/r/n/r/n RSV and cold symptoms overlap quite a bit, but there are some distinctions. /r/n/r/n cough /r/n/r/n/Stuffy or runny nose /r/n/r/n fever /r/n/r/n sneezing /r/n/r/n sore throat /r/n/r/n headache /r/n/r/n/Fussiness in babies /r/n/r/n fast breathing /r/n/r/n wheezing /r/n/r/n shortness of breath /r/n/r/n in baby, caving in of chest with breathing, flared nostrils, grunting, turning blue /r/n/r/n worsening of chronic respiratory conditions /r/n/r/n associated with developing bronchiolitis /r/n/r/n RSV and colds can cause symptoms such as /r/n/r/n Both RSV and colds can lead to illnesses such as pneumonia, an infection of the lungs, and bronchiolitis, inflammation of the small airways in the lungs, particularly in those with risk factors such as a weakened immune system and respiratory conditions. RSV is the most common virus associated with bronchiolitis. /r/n/r/n RSV can cause cold symptoms and additional symptoms such as /r/n/r/n in babies with RSV, particularly if severe. There may be /r/n/r/n vaccines are available for people who are at risk of serious RSV. /r/n/r/n There are no vaccines for colds because so many different viruses cause them. /r/n/r/n RSV is a virus that affects the respiratory system. /r/n/r/n colds are the result of an infection from a virus. More than 200 different viruses can cause a cold, but colds are most commonly caused by rhinoviruses. /r/n/r/n RSV and colds are spread in a similar way. /r/n/r/n Having RSV or a cold does not prevent you from getting it again. /r/n/r/n There is a higher risk for severe illness from RSV in adults who, /r/n/r/n infants and children who are at a higher risk of severe illness from RSV include, /r/n/r/n RSV can lead to or worsen conditions such as, /r/n/r/n symptoms of RSV, cold, and COVID-19 overlap. It can be difficult to distinguish between them without testing, but there are some distinctions. r/r/n/r/r/n/r/n cold/r/n/r/n/covid-19 Healthcare providers typically diagnose a cold by discussing symptoms and doing a physical exam. There is no test for the common cold, but the healthcare provider may run tests to rule out other causes for the symptoms. /r/n/r/n A nasal swab, or a sample collected by inserting a salt water solution into the nose and gently suctioning it out, may be used to test for RSV. /r/n/r/n If needed, lung function testing may be performed, such as a chest X-ray, oxygen saturation test, or computed tomography, CT, scan. Blood and urinary cultures may also be performed. Bronchiolitis related to RSV can occur with a urinary tract infection in newborns. /r/n/r/n It can be hard to know whether or not to contact a healthcare provider or to wait out what might be a cold. If you aren't sure, or you are concerned, call a healthcare provider, particularly if you or your child have risks for more serious illness with RSV or other respiratory conditions such as COVID-19. In some cases, antiviral medications may be used early into the illness. /r/n/r/n Get immediate medical care if you or your child are having trouble breathing. In an infant or child, this may look like /r/n/r/n Also, get immediate medical attention if your child has symptoms such as /r/n/r/n Call your healthcare provider for symptoms such as /r/n/r/n COVID-19, the flu, and RSV are all caused by different viruses, but they share similar symptoms, such as fever, cough, congestion, headaches, sneezing, runny nose, and shortness of breath. If you have symptoms such as these, your healthcare provider may want to run diagnostic tests to determine which virus is causing your symptoms, particularly if you are at risk for serious illness. /r/n/r/n Some symptoms of a sinus infection can also overlap with these illnesses, including cough, nasal congestion, headache, and fever. Sinus infections may also cause symptoms such as yellow or green nasal discharge, facial pain or pressure, and post-nasal drip. /r/n/r/n There is no specific treatment for colds and RSV. Treatment of minor symptoms involves managing comfort while the virus runs its course. More serious symptoms may need medical treatment. /r/n/r/n For adults, over-the-counter, OTC, medications for pain, fever, or cold symptoms may help you feel more comfortable. Check with your healthcare provider or pharmacist before taking any medications. If you are taking more than one medication, check the ingredients as they can overlap, and taking them together may result in taking too much. /r/n/r/n Children over 6 months old can be given Tylenol, acetaminophen, or Advil/Motrin, ibuprofen, as directed for fever. Children under 6 years old should not have OTC cough or cold medications as this can lead to serious and possibly life-threatening side effects. Do not give aspirin or aspirin-containing medications to any child or teen due to the risk of Ray's syndrome. /r/n/r/n Some ways to help manage symptoms and feel more comfortable include /r/n/r/n Antibiotics do not help with viral infections. They would only be beneficial if a secondary bacterial infection develops. /r/n/r/n Clearing mucus from your baby's nose is important. This can be done with saline and a suction bulb. In some areas, respiratory outpatient clinics may be able to do a deep suctioning with a tube down the baby's nose to help get the mucus out. Your healthcare provider may give you a prescription for this service. /r/n/r/n Hospitalization may be necessary in more severe cases of RSV. Hospitalization is most common in infants younger than 6 months and older adults. Hospitalization happens in about 2 to 3 out of every 100 infants with RSV. /r/n/r/n treatment at a hospital may include /r/n/r/n cold symptoms typically start within a few days of becoming infected and can last up to 10 to 14 days. /r/n/r/n symptoms of RSV are typically worse on days 3 through 5 of illness. On average, symptoms last 7 to 14 days. /r/n/r/n recovery may take longer in older adults or in more serious cases. /r/n/r/n RSV is typically contagious for 3 to 8 days, and those infected may become contagious 1 or 2 days before developing symptoms. Some infants and people with weakened immune systems may continue to transmit the virus for up to 4 weeks, even after they stop having symptoms. /r/n/r/n RSV can survive for many hours on hard surfaces, such as tables and crib rails, but typically lives on soft surfaces for a shorter amount of time. /r/n/r/n to help limit the spread of RSV and cold viruses, /r/n/r/n the Food and Drug Administration has approved 3 RSV vaccines for the prevention of lower respiratory tract disease, Arexvy for those aged 50 and older, and Abrysvo and Emrysvir for those aged 60 and older. Abrysvo is also approved for individuals aged 18 to 59 at increased risk. Arexvy and Abrysvo may increase the risk of developing Guillain-Barré syndrome, GBS, after the vaccine has been administered. /r/n/r/n The Centers for Disease Control and Prevention recommends RSV vaccines for all adults 75 years and older and for adults aged 60 to 74 who, /r/n/r/n The RSV vaccine can be given to eligible adults at any time, but it is recommended to get it in late summer or early fall before RSV typically starts to spread seasonally. One of the vaccines, Abrysvo, is also approved for adults aged 18 to 59 who are at increased risk of lower respiratory tract disease. /r/n/r/n Pregnant people whose babies will be born during RSV season can receive the RSV vaccine at weeks 32 through 36 of pregnancy. This reduces the risk of hospitalization from RSV for babies by 57% in their first 6 months after birth. /r/n/r/n Infants and some toddlers may receive an injected RSV immunization called bifidus, nirsevimab, which provides antibodies to protect against RSV and has been shown to reduce the risk of RSV-related hospitalizations and healthcare visits in infants by about 80%. It may be included in the baby's routine immunizations. /r/n/r/n Most infants only need protection from either the maternal RSV vaccine or infant immunization, but not both. /r/n/r/n Children under 24 months old with certain conditions that put them at high risk for severe RSV may receive a product called Synagis, palivizumab, given as an injection once a month during RSV season. /r/n/r/n RSV and colds share similar symptoms in most people. However, some people experience more serious illness, which may require hospitalization. Infants, older adults, and people with certain medical conditions are at a higher risk for serious illness. /r/n/r/n There is no specific treatment for RSV or colds, they typically just run their course. However, measures can be taken to help you or your child feel more comfortable as you get better. /r/n/r/n RSV vaccinations and inoculations are available for infants, pregnant people, older adults, and others who qualify. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.